medical support, and counseling. WAGCHELSEA staff let her stay overnight in their personal homes because there was no established shelter available to house them overnight. Unfortunately, not every child is as lucky as Purva. This is Shalu. She was born with a hole in her heart. She and her two siblings live with their maternal uncle and grandmother. Their uncle considers them to be an economic burden, and he often throws Shalu and her siblings onto the streets to force to fend for themselves and to beg from the upper caste. Purva and Shalu paint the picture of millions of orphaned and vulnerable children who live in unsafe and/or insecure home environments. We are standing before you today because we believe that insecurity is not the answer. WAGCHELSEA. WAGCHELSEA works to improve the quality of life of vulnerable children, women, and communities by providing health, education, and skill development. They operate primarily in the urban slums of Northeast Delhi in India. They also have an office in Uttar Pradesh. So what do these slums look like? There's poor sanitation, lots of overcrowdedness, many people living in a very small space, and disease spreads incredibly rapidly. So where do orphan and vulnerable children fit into this picture? Let's take a look at the statistic. Out of 150 million children living in India, 25 million are orphaned. Take a second to think about that number, 25 million. What is an orphan? For the purpose of our project, someone or a child between the age of 0 to 17 years of age who has lost one or both of their parents is considered an orphan. How about a vulnerable child? Vulnerable children can be characterized as children living in households that cannot provide a safe and supportive environment, either because perhaps both parents have a chronic illness, are being treated outside of the house for HIV and therefore cannot provide financial and economic support, or because the child has simply been abandoned. What happens to these children? Well, they're often exploited and trafficked, and they live very unfortunate lives where they are very unhappy. They typically suffer from abuse, malnutrition, chronic hunger, and many diseases such as HIV and malaria. So what's the current situation on the ground to help these children? Let's take a look. As you can see on this board, there are many logos that represent all of the organizations helping street children, not orphan and vulnerable children living in homes. There is not currently any organization or government program in India currently sponsoring help and aid for children who are orphan and vulnerable living in homes. And this is where our project comes in. I will now pass on to Alyssa, who will tell you about Project Reveal.
Thank you. Okay. So with Project Reveal, our goal is to fix the problem. We're going to be the first, we're going to be the innovators. So we want to have, the goal of Project Reveal is to provide the safe place for orphaned and vulnerable children, and it'll house up to 25 children at any time. Our ultimate goal is to enable the overlooked children so that they can become productive members of society. And to reach this goal, we have 4 different objectives. The first one, we want to collect all shelter supplies by the end of our 2nd month of implementation. By 6 months, we want to have all facility staff trained. Next, we're going to monitor and evaluate children's health and essential life skills. And finally, we want to increase their funding and community awareness to generate at least 50% of shelter funding. So a couple more details about what goes on at the Project Reveal shelter. Children will arrive from referrals from community social workers, but they're also free to come on their own. They're allowed to stay for up to 3 months at a time because it is a temporary shelter. After 3 months, they're either placed in a foster home or go back to where their home is if it's deemed appropriate by the social worker. And then while at the shelter, the staff will keep the children on the same track that they have been to kind of keep the normalcy in their life. So they'll go to the same school, and then they're also going to try and teach them the essential life skills, and also provide counseling services. And then finally, after they leave the shelter, the social worker will follow up with the children and monitor it from there. And then Hilda is going to talk about monitoring and evaluation.
Thank you, Elisa.
As most of you may know, most of the projects that go on in low and middle income countries come to a stop as soon as the implementers or the consultants leave ground. But I want to assure you that with Project Reveal, that's not going to be the case, because we have come up with a very thorough monitoring and evaluation tool that will help to assess and to make sure that the project is effective and sustainable as well. So one of the, we have a couple of points that the project coordinator, who will be essentially responsible for the monitoring and evaluation, they will have a couple of steps to kind of check, which we call the checkpoints. So in the beginning, one of the projects, the project objectives is to train the staff. And so we have training logs to make sure that all the staff are trained, and we have check-ins every 6 months just to refresh them on the courses that they have to make sure that they could take care of these children. We also have financial records to help the project coordinator kind of assess if what needs to be in the shelter was actually purchased and is in good working conditions. We also have surveys that will be given to children just to monitor. This will be done by the healthcare workers that work with the children, as well as the peer educators that will be teaching the children essential life skills. So they'll be evaluating them on how well they're progressing and how well their health is progressing while at the shelter. We also have community awareness surveys. One of our goals is to make sure that WAGCHELSEA can support itself at the end of the project, and it could still keep going with at least 50% of the funding. And how we do that is make sure that the community is aware of these services, and hence get potential donors that will be able to fund the project. So one of the tools, so some of the questions that you could ask, we've come up with indicators for each objective to make sure that some of the questions you could ask would be, is the facility functioning as a shelter as you wanted it to be? You could also ask if the facility staff are appropriately taking care of these children, because you don't want to provide a shelter and they're not being taken care of very well. So these are some of the checkpoints that we have to make sure that the facility is fully functioning and sustainable at the same time. So as you may refer to your folders that we handed to you, and if you did not, if you haven't moved pages around, the orange folders, the third paper in there talks about the monitoring and evaluation tool. This is to help assess the entire project, the entire progression of the project as a whole. You will notice that we have an objective. There's a criteria through which that objective will be assessed. There's an indicator that would show if that objective is actually being met, and then you check off. You check off the percentage that's been completed, and if it's not been 100% completed, what actions need to be taken or activities need to be done to complete this objective. So with that, I want you to be assured that Project Reveal will be sustainable and will be an effective program. I'll hand over it. Okay. Thank you, Manina. So, you'll be really surprised that this project is going to cost us just right around approximately 200,000 US dollars, which translates into 9 million Indian rupees. And this is over a course of 3 years. This is not just 1 year. And most of it is going to be, most of the cost will be incurred during the first year of implementation. Thank you very much, and now I'll hand over to Maria, who will take us through the sustainability plan that we came up with.
So there are 4 major components to sustain Project Reveal, being linking, networking, leveraging, as well as visibility. Linking entails WAGCHELSEA social workers going to local orphans and vulnerable children, as well as families, to make them aware of the free external services and programs that are provided by the Indian government, as well as other non-government organizations, like community and faith-based organizations. With WAGCHELSEA's help, families will be more willing and likely to apply for such assistance. For networking, WAGCHELSEA will assist local families to apply for and obtain public assistance services by helping them fill out necessary documents that is applicable to their needs. For leveraging, much of the project sustainability is dependent on leveraging and the organization's ability to do so. WAGCHELSEA must keep track of money and supplies, establish relationships with organizations as well as suppliers that may be able to help them, like buying in bulk to save money, or even receiving discounts on products if they contact a supplier and say what their mission is, assist orphan and vulnerable children. Also, recruiting volunteer peer educators and ensuring that older children staying in the shelter are acting as role models will also decrease the amount of staff WAGCHELSEA will have to hire, making it more sustainable. The last component is visibility, which would be heightening awareness of the shelter by creating a large sign in front of it with Project Reveal, as well as creating and distributing flyers and brochures explaining the shelter, its location, as well as the services that they provide. Also, distributing their annual report to various agencies will also assist with funding. Heightened awareness of Project Reveal will increase community and local ownership of the program. So after the first 3 years of Project Reveal, funding will come from community members and other organizations. WAGCHELSEA, they've been around for over 2 decades, and they're an internationally recognized organization, which basically proves that it's a very effective and well-built organization if it's been around for over 2 decades. Their current programs implemented assist female sex workers, orphaned and vulnerable children, as well as people living with HIV. WAGCHELSEA has the workforce needed to implement and sustain Project Reveal, with 36 full-time multidisciplinary workers, which, as referenced in your folders, there's a breakdown of the program manager, the project coordinator, the social workers, the healthcare workers, all encompassing various skills. Their governing board, along with designated supervisors, will assist in ensuring the goals and objectives of Project Reveal, as well as the mission of WAGCHELSEA is being met. Our team has also provided WAGCHELSEA with clear and measurable objectives in order to reach their goal. The structure proposed for Project Reveal is also already occupied by WAGCHELSEA, as their existing their drop-in center currently will only need to be refurbished. WAGCHELSEA is also highly capable because they've managed a budget totaling well over $1 million over the past 12 years with USAID and the Clinton Foundation. WAGCHELSEA is highly capable of implementing Project Reveal, and with adequate funding has the experience and passion to make thousands of more success stories like Porva's. And this is a picture of the U.S. Ambassador to India on his visit to WAGCHELSEA.
Thank you.